Hello, this is the American Medical Association's COVID-19 update. Today, we're taking our final look at the numbers for the year 2020 and all the news about COVID-19 with AMA's Chief Health and Science Officer, Dr. Mira Irons in Chicago. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Dr. Irons, more good news with vaccine authorizations this week, particularly in regard to the Moderna vaccine. Can you talk a little bit about this and next steps?
Absolutely. As with everything in this pandemic, there's good news and there's not so good news. But let's start with Moderna. It was another good week for vaccines. So the FDA External Advisory Committee, the VRBPAC, met on Thursday to look at the data on the Moderna mRNA vaccine. And the data show that it is 95% effective against people developing symptomatic COVID-19 infection and also severity. The data also showed that the Moderna vaccine may also be effective against transmission. They were able to look at their data in terms of asymptomatic cases and transmission. Pfizer is also looking at that data, but that was kind of an added benefit. And it's really preliminary look, but we'll have more on that over the next month, probably for both of those vaccines. And so the External Advisory Committee recommended that the FDA authorize the Moderna vaccine. And that occurred the following day. It is authorized for individuals 18 and over. You might remember that Pfizer is 16 and over. And the difference was that Pfizer had included some younger people in their trials, and Moderna had not. So the next day, the ACIP, the Advisory Committee on Immunization Practices at the CDC, met on Saturday, and they also voted to recommend to the CDC director that the Moderna vaccine be used for COVID-19 in individuals 18 and over.
Well, one of the interesting topics too of the weekend has been around prioritization.
Mm-hmm.
Who's going to get access to the vaccine after what this first wave that we're in with healthcare providers? What are you seeing there? How is this shaping up?
Yeah. So the ACIP met over the weekend. Saturday was really devoted to looking at the data on the Moderna vaccine. But what they did on Sunday was they actually spent a lot of time looking at prioritization of other groups. You might remember that the interim recommendation for ACIP was really focused on phase 1A. And that was directed toward healthcare workers and residents and staff in long-term care facilities. Given that the vaccines are already available and being distributed, they met to talk about what the next levels of the next groups would be for prioritization. And they voted on the two other phases of Group 1. So 1B would include individuals older, 75 years of age or older, and frontline essential workers. The CDC website has the list of who is included in that frontline essential workers, but I'll just mention a few: police, fire, first responders, individuals in the education community, teachers, support staff, daycare, food and agriculture, postal service, grocery store workers, and there are a few other categories in there. So that would be phase 1B. Following that, 1C would be individuals 65 and 70 to 74, individuals 16 to 64 with a high-risk medical condition, and there is a list on the CDC website. That is, it's a live list. There's currently a list there, and they did say that they would change that list as more evidence comes up for other conditions that may place people at increased risk and other essential workers. And I think it's important to remember that this prioritization is really being done because of limited supply of vaccines. And, several of the committee members in the discussion said that. They looked at that. They're very thoughtful. They looked at all the evidence. They had an ethics lens to this also. And they all said that they would love to not have to make that type of a prioritization decision, but it's really vaccine supplies that are forcing that.
And speaking of limited supplies, there were some issues around distribution and some expectations that were set that aren't quite being met yet. Can you provide some detail on that?
Yeah, so this is the largest scale of vaccine distribution that the country, I think, has done. And it was being coordinated by the Department of Defense. The states all had to provide their plans. The states were told how many doses they were going to receive. And then at the end of last week, or near the end of last week, what was heard was that states would get less than what they were expecting for this week and next week. On the one hand. On the other hand, Pfizer was saying that there were supplies available. And so what I heard this morning was that General Perna, took responsibility for that. I think it has been, or it is being settled. I think the other good news is that now that Moderna has been authorized, what I learned this morning was that 2 million doses of Pfizer are available for distribution. 5.9 million doses of Moderna are available for distribution, and so the supplies should be going out. It's hard for the states and it's hard for hospitals because you make a plan for how to tier individuals even within the hospital setting, based on risk, and then you have to modify it based on changes.
Oh, excellent. Thank you so much. This is good news heading into what could be a very dangerous period for us as we enter the holidays and New Year celebrations. We're already on a surge on surge situation coming out of Thanksgiving. Let's talk about the numbers. Not pretty.
Yeah, no, not pretty. The number today, as of this morning, 17,848,395 individuals diagnosed. We know that 7 to 8 times that number is probably the number that has been infected, and deaths of 317,684 in the United States. It's just tragic. I don't think any of us ever thought that the numbers would be that high. Last Thursday, we reached over 1 million new cases in just 5 days. The daily death toll in recent days has surpassed 3,200 days, and Wednesday saw 3,611 deaths in the United States in the single day, and that shattered the previous record on December 9th. The next 2 months are going to be tough. And I think that's really important to remember because, it's going to take a while to roll this vaccine out and people are still going to have to protect themselves and others.
Any state by state trends that show a difference from last we talked?
Yeah, it's as we've seen throughout this pandemic that the disease tends to kind of travel around the country in different ways. Hospitals are continuing to be overwhelmed. Now about over 114,000 COVID patients are in hospitals. The South is particularly worrisome. Over the last week, Georgia, Arkansas, South Carolina have set weekly records. Tennessee is confirming new cases as the highest per capita rate in the country. However, on the other hand, we see improvement in much of the Midwest and the Mountain West. Iowa is adding fewer than half the cases that it did in the November peak. South Dakota, Montana, Nebraska, Colorado, and Wyoming are all seeing declines. And you might remember those were the states we were talking about over the last few weeks. So it seems that there are different hotspots even within this latest surge in the country.
Well, we're seeing some unusual things globally, especially coming out of the UK, where there's been a strict lockdown on London and surrounding areas. Can you talk to what's happening there?
Yeah. If you look at just to mention the global cases, just shy of 77 million people diagnosed and just shy of 1.7 million deaths globally. But what is happening in the UK is that a new variant. We know that the SARS-CoV-2 virus does mutate. They have identified a new variant in the UK that has led to a further lockdown in London and really the southeastern England. It appears that the new variant may be more easily transmissible, but does not look as though it's more severe. It's even unclear at the present time whether it is more easily transmissible, but what led them to think that is that the UK had been seeing a decrease in cases due to lockdowns over the previous weeks, and over the last week showed a 51% increase. So the UK now has locked down through the holidays. People can only, in London and Southeast England, only celebrate with individuals in their own household, and cannot have to stay, at home. Other countries are suspending flights from the UK. France is also closing ports and, freight supply lines, just to try to keep this new variant from spreading more broadly, although there is a likelihood that it already has spread to other countries.
Hard to stop it from crossing borders. Dr. Irons, we're about 3 weeks or so past Thanksgiving. There continues to be a lot of analysis on what exactly happened and quote, the Thanksgiving effect.
Yeah.
Can you talk a little bit about what the prognosis is coming out of that?
Yeah, it's hard to know exactly. We worried about a surge, for Thanksgiving, and we know that numbers have been continuing to go up. But now people are talking about something more like a micro spreader event, rather than, like a major super spreader across the country, because we do know that people did listen to the public health advice and not travel in many areas. And so exactly how much Thanksgiving really contributed to what we're seeing currently is unknown. Like everything, since we first met this virus, we are learning things in real time, or shortly, thereafter. But Christmas is upon us. This week and next week, we have 2 other holidays, and regardless of how Thanksgiving affected the country, I think we still have to ask people to avoid non-essential travel, try to celebrate with people within your household, and please, wear a mask, wash hands, socially distance.
Absolutely. Well, finally, are there any key messages from the AMA coming out this week?
Yeah, last week was a busy week. Last Tuesday, the AMA, along with the AHA and the ANA, issued an open letter urging healthcare professionals to take the COVID-19 vaccine and share their experience with others. I think that's clearly happening. If you follow Twitter or if you follow other areas, there are a lot of pictures of doctors and nurses and, getting the vaccine. On the 17th, the AMA issued a statement strongly supporting the nominations of Xavier Becerra to be the next Secretary of Health and Human Services and Dr. Vivek Murthy to be the Surgeon General. The 17th, the AMA announced the additional CPT codes to include vaccines under development by AstraZeneca and the University of Oxford. The AMA had developed CPT codes for the Pfizer and Moderna vaccines early November. And this is important for tracking, to ensure, how many people are getting what vaccines. And finally, on the 18th, 9 national organizations issued a call for action to implement crisis standards of care during the COVID-19 surge.
Well, thank you so much, Dr. Irons, and appreciate all of your updates over the course of 2020. Hopefully we'll have better news for folks in 2021. We will continue to keep them updated and point them to the resources that the AMA is preparing for physicians and patients. That's it for today's final COVID update of 2020. Thanks, Dr. Irons. You take care. Have a safe holiday. We'll see you back in 2021. Thanks for joining us, everyone out there. Please take care. Stay safe.